I'm Dr. Roger Parthasarathy. I'm brand new to Austin, Texas. Just moved here from the Washington, D.C. area where I had been in private practice. This was a planned move for my family to come to Austin and join this wonderful organization, and we're delighted to be here in such a wonderful medical community and fantastic facilities, and glad to become part of the Central Texas medical community. I'm extremely excited to be part of the Brain and Spine Recovery Center. It is a unique center compared to virtually every other SCI or spinal cord injury center in the country. Most of them are located at large academic institutions, and the philosophy at those institutions tends to be one of adaptation, meaning that when someone has become injured or paralyzed as a result of a spinal cord injury, those centers focus on retraining them or allowing them to adapt to their new level of disability. However, with the collaboration this clinic enjoys with Lone Star Paralysis Foundation, Lone Star Paralysis philosophy is recovery. They want to be able to engineer outcomes for people with spinal cord injuries to recover their ability to walk and remain as functional as possible. And with that philosophy driving this clinic, the outcomes here, I think, have been improved compared to what's being seen in other clinics, mainly because we are, in essence, pushing the envelope in forcing people to walk using whatever residual capability they have to be able to walk. Of course, this can't be accomplished without having phenomenal equipment, such as the ZeroG that we are fortunate enough to have. As I understand it, there are only about 14 of them in this country. So we are extremely blessed as a result of our collaboration with Lone Star Paralysis to have access to this equipment to be able to offer to spinal cord injured patients in Central Texas. The ZeroG is a robotic ambulation device, and there are only about 14 of them in the country, and through a series of computers and microprocessors, it basically harnesses a patient while they are ambulating or performing virtually any functional task, and this follows them and follows their movements and allows them to become functional, but will not let them fall. So it allows them tremendous mobility and range of motion, and it offers a counterweight to reduce some of their body weight, thereby enabling patients with paralysis or weakness to be able to ambulate when they could not have otherwise. We have a variety of other equipment. We have what's called the FES bikes, which is functional electrical stimulation, where there are electrical stimulators that stimulate the muscles to perform activities. So in other words, patients with quadriplegia who couldn't dream of pedaling a bike, through the use of FES adaptations can now pedal a bike, and this is important in terms of maintaining muscle balance, muscle tone, reducing spasticity, improving bone mass, and to some degree, I think, facilitating the regenerative process. This clinic cannot be what it is, or could not have become what it is, without Doug English and Lone Star Paralysis Foundation and the extreme generosity of all their benefactors. It's because of their interest in helping people with spinal cord injuries and their interest in securing equipment to help promote the recovery process that's allowed this clinic to be able to blossom in comparison to virtually every other clinic in the country.